Did you listen to Jeff and Professor Hamo in the morning? Here's what you missed.
Nancy, you are off medication. And Ruth, you're both off medication.
Yes.
Irene, sorry.
Irene.
Why?
After chemo and radiotherapy, so the doctor said, you just change your lifestyle. So you live positively. So that's what we've been following.
You've been living positively.
Yeah,
what does that mean? What does that mean?
You live as that. Now you have cancer, but you assume you don't have it, or you've been treated, and now you live your life, a normal life.
Is that what you're doing?
Yeah, a normal life.
Same with you, Irene.
Okay, thank you. After the medication of chemo and the radiotherapy, and then a bit of counseling from our doctors, we are living as you don't have a cancer. But you know, inside you have the cancer, but the tongue helps you a lot.
So tell me something. You know you have the cancer.
Yes.
Do you feel it sometimes? Do you feel the pain? Do you feel...
It is not easy that sometimes you get some pains, but you don't relate to the cancer. But sometimes when you get that pain,
it hooks your mind.
It takes your mind back.
Yes.
Yes.
But you don't want to know. You're praying that it's not that thing.
Yeah, that's what we assume.
Why? Why don't you want to take medication? Is it because you can't afford it, or you finished the doses? What happened?
Okay, it is not, we can't afford it. Like when the test was done, after chemo and the radio, like mine, it came negative. That is progesterone, estrogen negative. And the other one, hay negative. So after that, we started the counseling and also the follow-up to the doctor.
And this was 6 years ago?
6 years ago.
About you, Nancy?
Yeah, even me.
Same
we were
thing.
in the same ward with
the same ward at the same time. We operated at the same time. We shared the same room. Where we had gone for the chemo.
Yes.
We used to help one another. We didn't know one another, but we met in the ward.
Were there other women in that same ward?
Many of them, they have all gone. We are just left with Nancy.
The rest are dead.
Yes, they are all dead. But we used to share the same. We used to talk the same. Although we had a good handshake.
There was a time I was dying when I was given the chemo. So I was given direct.
Yes.
You know, they should be given
through IV.
So the doctor came and gave me direct injection. I died that time. Irene resurrected me.
Are you serious?
Yeah. I just collapsed.
And then?
I don't know what she did. She can tell us what she did.
What did you do, Irene? What did you do?
What happened? There was a doctor who came. Is it a Muslim? Mwarabu. When he came and he started the chemo for Nancy. And when he started the chemo, he gave direct. After giving the direct, I saw the girl went down. So after that, I went to the bathroom. I came with a towel. I tied her because she was complaining of the hotness in the head. So what happened? Then after that, she woke up. Then after that, that is the same doctor came to me. He wanted to put me the chemo. So I told him, you can't give me the chemo. I have my own doctor, who is Dr. Catherine Ogesa. But he told me, but I have been sent by her to give you the chemo. I refused. After I refused, he told me, you are very proud and you will die. I told him, I won't die because of you. I will die because of my God. So I was not putting the chemo. So after 2 minutes, I saw Dr. Catherine. Amekuwa paged, amekuja. So, she's very a quiet doctor. She didn't talk much. She just told me, okay, Irene, I'm going to put you the chemo. So I told her, it's okay. And that time is the time Nancy alisema, even me, I want to be seen by this doctor.
Huyu wa kuagiza watu wa kuongeza joto.
Just collapse and die.
Dr. Daniel Butorire, we hear nightmare cases of patients being misdiagnosed, patients being mistreated. And you know, this is the third largest killer in Kenya today. Third largest killer in the world. Cancer.
Yeah.
And yet doctors are, we hear these horrific cases.
Last week ulisikia mtu amekatwa mguu.
Alikatwa mguu.
Ati misdiagnosis. Anafika Nairobi anaambiwa.
And it happens, Doc. It happens.
Yeah, it happens. But the problem is that, as you have heard, we have very few oncologists in Kenya. And that's even informs why people are rushing to India, to South Africa to get treatment. But these cases are going down. They're not as many as we used to have in those days. I would just say that we need more training for doctors, and even those who are around, they need to be retrained on how to manage cases of cancer.
Yeah.
Like I've told you, I've been working under an oncologist for the street last 10 years. So everything we do, everything these doctors are doing, it's supposed to be overseen by the oncologist.
Are they overwhelmed, these doctors? Because of all these cases, are they overwhelmed?
You can say so, that the doctors are strained. But you see, with good training, you can get people who are qualified to work under you. Because even when you look at the chemotherapy administration, it's not done by the oncologist. The work of an oncologist is to prescribe the best treatment according to the international protocols. But the oncologist cannot stand there because some of these chemos have to run maybe overnight. Some have to run for over 6 hours. So the oncologist cannot sit there or stand there until the chemo is over. So you may find some interns who come to change without proper following the procedures. Mistakes can happen.
Sure.
Yes.
But mistakes at the cost of people's lives.
Yes.
It's you can't rectify that. You can't undo it. And speaking of which, yesterday a woman was diagnosed with cancer at Kenyatta National Hospital.
Yes.
She was told she has cancer, breast cancer.
Breast cancer.
She got into a matatu, drove to Naivasha, and committed suicide. She couldn't handle it. How are you handling it? There's a woman today and a man today who's just been told they have cancer. You folks are living with it for 6 years. What do you tell that new case, new warrior?
Okay. What we can advise the new warrior is just to accept the condition. After accepting the condition, to avoid what is to go and see the doctor, and then after that, what the counseling being done by the doctors who are there, she follow the advice. And
That's easy for you to say, Irene. Someone is devastated, Nancy, right now. They're devastated. They want to commit suicide. What do you tell them?
Like me, when I was diagnosed, when the doctor told me, it's Kenyatta, so the files have been put, wale mko na cancer, mtaambiwa what to do. Yeah. So my file was on the other side.
Wow.
And it was in the evening, so I was waiting for the results, what I didn't expect. So tumekaa tu na mama mwingine, we are waiting. Akaniambia, so you people, you have cancer. Get into that room, you book for the surgery.
Na mnaenda tu kama mbuzi.
Si ndio? That's what they do.
Design unapatiwa. Result ni kama umekujia tu.
And you are just giving your results this way.
Yeah.
But it's good. Some of us, they don't know how to read the results of the doctor's report.
Yes.
Yeah. So the other woman was given, she was a kissy. When she was told, she had breast cancer stage 4. What she did, she only cried. Na lipotea.
Akaenda.
Hakupatikana. She went that way.
And
so
you don't know where she is?
No, we don't know.
And she was stage 4.
Stage 4.
This happens a lot, Butoirere. People, they don't do early detection. They find out when it's almost too late. I want to talk about that after the break. Screening. Or what should be done. And also, out of the 47,000 new cases a year, how many make it, doctor? What's the number? Tell us.
Yeah, out of the 47,000 new cases every year, we said we are losing 32,000. That's about 70%. So the ones who are making it, it's about 30%. So when we talk of the survival rate in the last 5 years, which is the incident currently,
Yes.
it is about 5,600 there.
And I also want to talk about diet, lifestyle.
Yes.
Is that what it is about? Did we have cancer back in our day? Nancy, when you were growing up, how many people, Irene, how many people did you know who had cancer? I knew very few. One or two. What is it? Is it lifestyle? Is it diet? Is it
Vyakula hizi tunakula.
ni hisi?
Mboga ya sewage.
Ni simu?
Unaona ziko hapo.
Mboga ya?
Ya sewage. Ya, ni tamu.
Let's take a break, come back. Maybe you have some questions as well. Let us know at Koinange Jeff.
At Hamo Prof.
At hot_96 Kenya with the hashtag.
Jeff and Hamo on hot.
We're talking cancer on this Tuesday. And Dr. Daniel Butorire. He's part of the team at Texas Clinic Cancer Center, yeah. Right here off Bagathi Way,
Yes.
which is always filled to capacity. 47,000 new cases reported in this country. Cancer every single year. And how many oncologists?
Oh, 23.
23.
2, 3.
As in 23,000?
1, 2, 3. I can count. Yeah, there are 23. See at wengi? 23.
Dr. Daniel Butorire,
And we lose
how
that.
important is it to counsel the patient once they've been diagnosed with cancer? How important is it?
It is very important, Jeff. You find that there has been a lot of information out there. People think that cancer is a death sentence. But we have seen yourself, we have warriors who have left, who have been living with this disease for the last 6 years. We did the treatment. We have been following them up. We can't detect any cancer in their body. You know, we normally say as much as we are treating you for the current disease that you have, which is cancer, we are not really treating you the risk factors. And though the risk factors range, even genetic predisposition, they say especially for breast cancer, if you have had a relative who has had breast cancer, your chances of getting breast cancer are higher than any other person. Other risk factors include the environmental hazards, the smoke in the air, even your body physique. Like for the cancer of the breast, we normally say if you have high body mass index, if you have a weight that is higher than the standard required standards, your chances of getting it are so high. So we are not treating you for those risk factors. We are only treating the disease that is there. So that's why she's talking about change of lifestyle. It's very important. Your diet is very important. So counseling a patient before telling them their diagnosis, it prepares them.
Yeah.
You know, in every chronic illness, once you're told that you have a chronic illness, you go through stages. The number one stage is denial. You start denying that, oh, why me? I don't even take alcohol. Why me? I go to church every day. Why me? So that denial comes in. Then number two stage is that stage of anger. The people start becoming angry. Now before they reach that stage of acceptance, already they have gone through this stage. Counseling is very important before you tell them their diagnosis.
So Irene and Nancy, how did your diet change? Were you eating nyama choma before? Were you eating, anything, everything, drinking alcohol? Irene?
Iko mwenye ameangaliwa. Tunasema ni nani wacha ajibu. Watu wa pombe zaidi.
Kusema ukweli, my lifestyle was not so bad. Kwa maana nimelelewa kwa kanisa na wazazi wangu although wamepass, they all passed, na lifestyle yangu haikuwa mbaya vile. So hii kansa yangu ilikuja after 50 years.
After 50 years.
Yes. So ilikuja after 50 years na it all started after. When I reached 50, my uterus was removed. Because ilikuwa na growth. So after that one, ndio sasa, the body becomes low immunity. So after that, so tukaanza kusema ni mzuri waanze kukunywa kama na uterus kitolewa, si hauna estrogen. Sio daktari. Hauna estrogen.
Kunywa tu.
Sasa ukaamua tuende bypass.
Sasa ukaamua kwenda Naivas, unachukua nini? Wakati huo kulikuwa na kumata kulikuwa na Naivas. Unaenda unachukua nini?
Kitu.
Ile kitu kanaitwa aje?
Kibao.
Sio kibao. So ile estrogen iko down. Unaenda unachukua soya. In fact, I used to take soya. So after taking, I was taking soya instead of tea leaves. So what happened? Me ndio nilidiagnose nikaanza kuona hizo pimple, hizo kadude.
Yes.
So kwenda sige imagine it is a breast cancer because, lakini nikasema because I nursed my father who had throat cancer and my sister who had ovarian cancer. So I said maybe it is coming genetic. Naona nikakuwa na misdiagnosis. Also mimi pia kwa maana hiyo pimple hiyo inaitwa kadude ilipatikana kama ni mastitis, na mastitis is an infection. So I was given antibiotics. So after taking antibiotics sikupona. That's why I decided to go to another doctor. That is tunasemaga second opinion.
Correct.
So ndio nikaenda kuona daktari. Ndio sasa akadiagnose after kufanywa biopsy na mammogram ikapatikana stage 2. So ndio nasema ni mzuri hata vile government iko ituangalie mzuri, hata sisi tuko na hiyo breast cancer na tumesurvive. Wakitafuta specialist, hata sisi tuna suffer the disease. Si tutomeshwe. Kama na we are near the patient than the doctors, because we go to the villages, we go to area kupima watu. Ukisikia mtu hata saa ingine unasikia mtu anakuandikia message ati niko na breast, na sasa I don't know where to go because amekuona kwa TV.
Ni wengi huko mashinani, ni wengi
wako wako. So unaenda unaangalia wale wako kwa huko, unawatuma kwa daktari, na kusema kweli wakipimwa inaonekana positive. So ni mzuri hata wale wako na kansa kama sisi tuambikiwa manani, daktari anasikia. Na ndio tulikuwa tunasema tunakuwa na Weso Cancer Support Group, na tunaendaga Texas kwa Dr. Nyongesa. So at least some of us who are suffering, who suffered because we suffered, now we are not suffering. We can be good messengers of the other people in the community.
So you're volunteering yourself. Unataka kusaidia watu.
Kusaidia wengine.
Is it the same with you, Nancy?
Yes.
Also?
Yeah.
Yes. How has your diet changed?
My diet, I take a lot of vegetables and fruits. Yeah. I take a lot of vegetables, fruits, a lot of water. Sasa nyama nimekata kidogo, but the doctor told us that you eat moderation. Because even your body needs some energy for that. Now that's what I do. So I don't drink, I don't smoke.
Did you smoke before?
No smoking.
Did you drink before?
No.
Pastor anasikia na kuna haja tuharibu ushuhuda.
Your moderation seemed bad. Sorry, you
Actually, there is a misnomer about alcohol.
Yes.
There is no research that has shown that alcohol causes any form of cancer.
Hallelujah.
But here is the catch.
Yes.
If you are taking alcohol and at the same time you are smoking cigarette, it increases the permeability of the carcinogens within the cigarette to enter your body. And actually, I just completed another research recently. I'm doing a research about head and neck cancers.
Okay.
The cancers that affect the regions of the head and the neck.
Which are, name them.
Like we call them nasopharyngeal carcinomas, postnasal tumors, the cancer of the thyroid, the cancer of the throat, all those that affect the regions on the nose, the mouth and the throat. And we find that almost 80% of these patients reported that have smoked cigarette. And they have used cigarette for more than 2 years. And even some of them are still currently smoking. So cigarette is worse than alcohol. Alcohol only increases the permeability of the carcinogens within the cigarette to be able to cause cancer. But we are saying even food, anything you take in moderation. Excess of anything is poisonous to your body.
And doctor, every one of us has cancer cells inside them, right?
Yes.
We all have cancer cells.
We normally say your immunity plays a very important role in surveillance against cancer cells within the body. You know, cancer is abnormal growth of cells within the body. So you have those solid tumors, like the cancer of the breast, like we have mentioned. But we have also the blood cancers, like the leukemia, the acute myeloid leukemia, chronic myeloid leukemia. Those ones, it's still abnormal overgrowth of cells. It can be within the blood system, within the bone marrow, or within the tissues in the body. So what causes this abnormal overgrowth? Normally, what controls the multiplication of the cells in the body is what we call the DNA. Sometimes this DNA undergoes some mutation and it becomes defective.
Right.
So your immunity is very important in trying to survey against the bad cells and remove them from the body. But when your immunity goes down, the chances of getting cancer increase. And we are seeing some of the patients with HIV, they are more predisposed to getting certain types of cancer. We call them HIV-defining cancers, like Kaposi's sarcoma, like the non-Hodgkin's and Hodgkin's lymphoma. So even immunity, just your immunity alone, can help to reduce or to increase the chances of getting cancer.
Yeah. Not Hodgkin's lymphoma.
Umesikia na hii mambo ya hewa, you know, the pollution in Nairobi.
Yes.
Yes.
Yeah, sasa hii ndio mbaya zaidi.
We did a story over the weekend, Enoch Secolia, right? Called the Toxic City.
Yes,
Choking City.
Yes.
Right? Choking City.
Yes.
And we are being choked, Daktari. And ile mboga mentioned.
Yes, hizo mboga.
Kwa sewer.
Yes.
And it is still the smoke that we are talking about, the hydrocarbons within the air. This messes around with our DNA so much, bringing those errors. As I told you, there are signals within the DNA that tells a cell to continue multiplying, to replace the cells that are dying in the body. And there is a signal, a cell is supposed to divide up to a certain time and then stop. And then undergo what we call cell suicide. The old cells die, the new cells replace the old cells. But these hydrocarbons within the environment are the ones that are damaging our DNA. So normally the body has a way of repairing this DNA. But these defective hydrocarbons within the air, if they are too much, the nitrates, the repair of DNA becomes difficult
or impossible.
So the cell continuously divides and divides and divides, and then it becomes either a tumor or within the bone marrow, like the leukemias that we are talking about. And then also about the hydrocarbons and the carbons within the air, they destroy what we call the ozone layer. Ozone layer plays a very important role in terms of protecting us from the UV lights. It has been known that skin cancers are caused by the UV lights, the radiations from the sun. This ozone layer is supposed to cover us from the UV light. But once you destroy the ozone layer, now the UV light can penetrate our skin and cause what we call the basal cell carcinomas and other cancers of the skin.
Good Lord. Ladies, do you think of dying?
No. Why? Why should we die now if we didn't die the other time?
Wakati tulikutana na Mwarabu.
We can't die now.
Irene?
We can't die. We are waiting for the God to come.
But every day you're seeing hata wakubwa wanakufa. Kila siku. Does that scare you? Because, you know, they have access to all kinds of medical attention. Na nyinyi hamna.
Sisi hatuna, and then they fly out. Sisi we are just here, but we are still surviving. So we just have that hope. We still have 10 to 20 years. 10 to 20 years.
Unahakika?
I'm sure. Not a kicker.
Yes.
Irene?
Yeah, I'm very sure. Na niko na hakika nitalive for another 100 years.
Oh, yeah. Makofi kwako.
Unasikia roho?
100.
No roho.
Actually, they say
Yes.
patients with cancer, most of the time, they die with their disease rather than from their disease. People are dying of simple things.
Yes.
You hear a patient of cancer has died. Most of the time, it's not because of the cancer. These are the complications. And what are some of these complications? It is the immunity. No immunity. They die from simple infection, like pneumonia. Even malaria can kill a patient with cancer, not because of
Not the cancer.
not the cancer itself.
Yes.
Because the stress levels after diagnosis, if you don't put them in support group, if the family is not supportive, if they are not getting a balanced diet, their immunity will go down. And they will succumb because of simple infection.
Yes.
Most of these patients have not died because of cancer. Some of them, they are bedridden. So once they are bedridden, they develop blood clots within their veins. And this blood clot can dislodge, go block the lungs, what we call pulmonary embolism. And then they will succumb from that rather than from cancer.
Doctor, would you urge patients right now, would you urge people right now to go for early screening? Do you recommend that?
We are saying if you have had symptoms and you have been treated for these symptoms and they are not disappearing, you need to seek for a second opinion. And actually just tell the doctor, screen me for cancer. Because the problem with cancer is that the symptoms mimic just any other normal infection. So we are not saying there is no cause of alarm in Kenya right now, because the incidence of cancer is increasing globally. But as much as we want to screen, you must have in places the infrastructure for treatment. Because screening people for cancer just raises anxiety. And you see, screening is not diagnosis. Do you know that? You can be screened for cancer. You have a breast lump, you go for screening. What are the screening tools that we have? Number one is physical examination by yourself and by the doctor. And then number two, they will send you for a scan. Still, this scan is not conclusive for cancer. Then you need to do a biopsy for you to confirm that you really have cancer. So screening alone is not going to help in reducing the cases. We need to screen, we need to make a diagnosis, and we need to have infrastructure in place for treatment.
Are we doing enough?
We are trying.
That's not the answer. Can we do better? I see counties now are going to set up some cancer labs. Umeona? But you know, this is an afterthought. This is after
the end product.
After so many people have died, alafu you realize, hii gari ni mbaya.
Tujengeni hii kitu. Na sasa hiyo ujaanzia huko.
Isn't that a little late, Daktari?
I wouldn't say so.
Do governors have to die and MPs have to die for us to wake up?
So that's
That's just a wake-up call. But people have been dying, Jeff, from cancer. Some we didn't even know that it's cancer. But now we have better machines, better technologies that are able to detect these diseases. You find that people have been, initially before we got the machine, what we call the gene expert, for diagnosis of TB. People used to be put on empirical treatment. Empirical treatment is you start a patient on treatment as you wait for diagnosis. So people used to have cancer, but they are being treated for TB. You understand? Because it takes long, like 3 weeks, for you to be able to culture the bacteria for TB. And then the symptoms are just mimicking TB, and yet it's lung cancer.
And where can we come for this diagnosis? Where? Can we come to Texas? Mani ndio tusikuje ipatapotea. This is hii mambo ya trial. Hii si Toyota. Ingekuwa problem.
Unajua cancer it's not painful.
I'm not going through Middle East.
It's not painful
at all.
Where can we
that's
go?
why there's a big, you know, something which is painful, you feel that let me go to the hospital because you are feeling that pain.
Yes.
But for that lump, you don't feel anything. Imefura tu hapo, but it's not painful. That's why you see so many people ignore it.
Yes.
And the times when it comes so painful, it has reached another level. What is it that doctor?
Like you find 80% of patients really go to hospital because they are experiencing some form of pain.
Yeah.
But the number one killer or number one in terms of incidence cancer in Kenya is breast cancer. And how does it start? It just starts with a painless lump in the breast or in the axilla. So the patients, we find that they have had this lump for the last 1 year, 2 years without knowing. And because it's not painful, it doesn't bother them.
Yeah.
But we are saying if you are seeing anything suspicious in your body, you know your body better than anyone else.
So
Just-
self-examination.
Yes.
If you see something, just go.
Just go to the hospital.
Yeah. And it could be nothing, by the way.
Yes, we have had, and actually they say out of 10 women with a breast lump, only like 2 of them is cancerous. So the 8 women will be having like what we call the fibroadenoma, which is just a benign tumor. Yeah.
Okay. Is there hope, ladies? Nancy, Irene, is there hope?
There is hope. There is hope because you can't die of cancer, you die of other diseases, complications.
Yes.
Cancer is not a killer, but other complications.
Will kill you.
Yeah, will kill us. Yes. Now avoiding the lifestyle is very important in cancer. Here the treatment.
Yes.
A very good one because lifestyle starts with me. I do the exercises. Even the other times we go for what do you call it? That even we go
Zumba.
Zumba.
Ah.
Who does Zumba?
Eh,
Zumba.
Zumba.
We go for Zumba.
Unati nice.
We go for Zumba. That's why we are here.
100 years.
100 years because of Zumba.
That's wonderful. You know, you're giving a lot of people a lot of hope, and we appreciate that. We would like you to stay a little longer, if you don't mind, a few more minutes, Dr. Ari. There's a few questions here for you especially. Like Mercy Litara is asking, hello, doctor, do lotions and creams applied on the skin cause skin cancer? Let's talk about those and other questions. And I'm glad the ladies are giving people hope out there. You do Zumba, munenda jogging or swimming or muna nini nyingine? Or yoga.
Or even yoga.
Kula
We go
doma.
for massage.
Greens.
Even
Massage.
massaging.
Irene.
Yes. That's why we are here.
Yes.
We'll take a break. Plenty more. We're talking cancer this morning. It's serious. 47,000 new cases a year in Kenya alone. The 3rd biggest killer.
Jeff Koinange and Professor Hamo every day, Monday to Friday from 6 a.m. to 10 a.m. only on Hot 96.